Welcome to the Deep Dive. You've curated a really thorough set of materials on ADHD, and that's exactly what we're going to explore today.
Sounds great.
We'll be unpacking what ADHD looks like, those conditions that often, accompany it, how it can change across someone's life, and the different ways it's approached for treatment in both children and adults. Our mission is basically to extract the most valuable insights from your sources so you come away with a strong understanding, but without feeling, totally overwhelmed by information.
Absolutely. And your collection of information is quite comprehensive. It covers everything from the formal diagnostic criteria to the subtleties of how learning difficulties and behavioral issues can intertwine with ADHD.
Right.
We also have a good overview of how ADHD can present differently as people age and a look at the various treatment strategies available. It's a really rich landscape, and we're looking forward to making those connections for you.
Okay, let's jump right in then. Understanding ADHD in children first. One of the immediate things that stands out from your sources is that ADHD, it rarely appears on its own. It often has other conditions associated with it.
Yeah, that's a crucial point. What's fascinating here is just how frequently ADHD overlaps with both learning disorders and what we call behavioral disorders.
Okay.
On the learning side, we're talking about specific difficulties.
Right.
Areas like reading, often termed dyslexia,
Right, I've heard that term.
Yeah, and also challenges with writing and math. To give you a sense of how common this is, studies suggest that a significant chunk, maybe somewhere between 25 and 40%, of children with ADHD also experience these specific learning disorders.
Well, that's quite high.
It is. So the crucial takeaway here is that ADHD rarely exists in isolation for many children. We're looking at a complex interplay with learning and behavioral challenges that, significantly shapes how the ADHD presents itself.
That's a really significant co-occurrence. And then you mentioned behavioral disorders as well.
Yes, the most commonly seen behavioral ones are oppositional defiant disorder, or ODD, and the more serious conduct disorder, CD.
ODD, okay. What does that look like?
So ODD is characterized by this consistent pattern of anger, arguing, stubbornness, a tendency to defy adults and deliberately ignore others.
Sounds challenging.
Very. And in clinic settings, the rates can be quite high. Some studies indicate maybe 40 to 50% or even more of kids with ADHD also exhibit ODD. It's worth noting, though, these rates might be lower in children seen in, say, private practice settings.
Okay. And conduct disorder, CD, you said that's more severe.
Correct. CD involves a pattern of more serious behavioral issues, things like early aggressiveness, fighting, truancy, lying, stealing, even destruction of property.
That does sound more serious.
Yeah. Studies in clinic settings report that over 15% of children with ADHD also meet the criteria for conduct disorder. Again, these numbers might vary. What's really important to remember is that these co-occurring conditions can significantly influence how ADHD manifests and, consequently, how it needs to be addressed.
This really highlights the complexity, doesn't it? It's definitely not just about attention and hyperactivity.
Not at all.
Now, your sources also strongly emphasize how vital it is to identify and treat ADHD early in children. Why is that so crucial?
Well, if we connect this to the bigger picture, early identification and treatment, they sort of set off this chain reaction of positive effects. First off, it provides immediate help to the child.
Right.
By addressing the core symptoms of ADHD, we can improve their ability to learn in school. And that, in turn, can lessen the anxiety and even depression that can come from academic struggles, social difficulties, conflicts with parents.
That makes sense.
Essentially, early action isn't just about managing the symptoms right now. It's about preventing this cascade of negative consequences that can impact a child's whole life trajectory.
So it's intervening before those negative patterns get really deeply ingrained.
Precisely. Early intervention can prevent a child from falling further behind academically and socially. And this can have a profound positive impact on their self-esteem, their overall well-being. Furthermore, early treatment may also decrease the risk of these children developing more serious problem behaviors as they move into adolescence.
That makes perfect sense. Addressing the foundational issues early could prevent more entrenched problems later on.
Exactly.
Your sources also make a point of noting that while we sometimes hear about the energetic and creative aspects of kids with ADHD.
Yeah, the sort of romanticized view sometimes.
Right. It's really important to understand the potential for serious lifelong problems if it goes unaddressed.
That's a crucial point to underscore. While some individuals with ADHD might indeed be energetic or creative, it's vital not to, romanticize the disorder. Your sources are clear. ADHD can lead to significant and lasting difficulties that severely impair a person's life across many areas: academic, social, work, personal life. Early intervention is truly key to lessening those risks.
So how is ADHD actually diagnosed in kids? What does that process generally involve?
Well, diagnosis in children, it's a multifaceted process. It typically starts with gathering a detailed history from parents or primary caregivers.
Okay. This helps clinicians understand the child's developmental background, when symptoms first appeared, how they've changed over time, that sort of thing. An interview with the child themselves is also an important part, although, younger children might not be able to fully articulate their experiences.
And it's not solely based on what parents observe, right? You need more perspectives.
Correct. To get a comprehensive picture, rating scales are also used. These are basically questionnaires completed by teachers and other adults who know the child well, maybe coaches, after-school program leaders.
Okay, multiple viewpoints.
Exactly. These scales help describe how frequently and severely the ADHD symptoms occur across different settings. The information gathered from all these sources, the history, the interview, the rating scales, is then carefully reviewed to see if the child meets the diagnostic criteria for ADHD.
Now, thinking about the really early years, like infancy and toddlerhood, are there any behavioral signs even then that might suggest ADHD later on? It's interesting. Even in infancy, some parents report their children being particularly restless. As they become toddlers, many of these kids become incredibly energetic. Parents often describe them as being constantly on the move, getting into everything, having this tendency to touch and, well, often break things.
The classic little explorer dialed up to 11, maybe?
In some ways, yes, but with an intensity and impulsivity that goes beyond typical toddler behavior. Your sources mention instances of toddlers unexpectedly getting into dangerous situations, like climbing on top of refrigerators or wandering into the street seemingly without thinking about the consequences.
Wow.
Mothers often feel like they have to watch them constantly to prevent accidents or damage, and unfortunately, this parental intuition is often correct. Children with ADHD do have a higher rate of accidents. They're more likely to end up in emergency rooms.
That's startling.
And this increased risk, sadly, even extends to a higher likelihood of car accidents once they become licensed drivers.
Wow, that's a really striking statistic. It paints a vivid picture of the challenges for parents, even then.
It really does.
That really illustrates the challenges parents face, even in those very early years. And you mentioned impulsivity earlier as a key characteristic. Can you elaborate on how that shows up in children with ADHD?
Impulsivity, or poor impulse control, yeah, it's indeed a core feature. It's characterized by acting without thinking about the consequences. It's almost as if the child's ability to pause and consider their actions is significantly less developed than their peers.
Okay.
This can show up in various ways. For instance, they might have trouble waiting their turn in games or conversations. Or they might blurt out answers in class before the question is even finished.
So it's that immediate reaction without any forethought.
Exactly. And this impulsivity can also extend to their emotional responses. Children with ADHD can become very quickly upset if things don't go their way. And this can sometimes lead to aggressive reactions, like hitting siblings or classmates in the heat of the moment. It's not necessarily malicious, but rather a difficulty in regulating those immediate impulses.
Okay. Let's circle back to the learning disorders you mentioned earlier. You broke them down into reading, writing, and math. Can we delve a little deeper into what those specific learning impairments look like in children with ADHD?
Certainly. So when we talk about reading impairment, often called dyslexia,
Right.
the main difficulties lie in accurately, rapidly, and fluently reading single words. Children might mispronounce words, confuse sounds, even struggle with learning to write their own name in the early years. They may have trouble recognizing rhymes, which is, a foundational skill for reading development. As they get older, they might struggle with longer, multisyllable words, and their reading tends to remain slow, requiring significant effort. In some cases, they might even be able to decode the words, but still struggle to understand the overall meaning of what they've read.
That sounds incredibly frustrating for a child.
It really does. And what about difficulties with written expression?
Yeah, tell me about that.
Impairments in written expression often show up as significant problems with spelling, grammar, punctuation. But beyond just the mechanics of writing, these children can also have difficulty organizing their thoughts and expressing them clearly and logically in written form.
So it's not just typos.
No, it's not just about making mistakes. It's about The entire process of translating their ideas into coherent written language. It's a struggle.
And finally, math impairment.
With mathematics, your sources describe a lack of what's called number sense. This can involve trouble recognizing numbers, difficulty with even simple calculations, a struggle to grasp basic math facts. They might also have difficulty with numerical reasoning, problem solving. It's not uncommon for children with math learning disorders to reverse figures when writing them down, or to struggle significantly with word problems that require them to apply mathematical concepts.
It's important to point out, though, that these learning disorders aren't tied to overall intelligence, right? Your sources really emphasize that.
That's a critical distinction, absolutely.
Oh,
Your sources stress that learning disorders occurred despite normal intelligence, despite adequate teaching methods, and in the absence of any underlying psychiatric illness. They're classified as neurodevelopmental disorders, meaning they represent a failure to acquire specific academic skills as a child develops. This is different from intellectual disabilities, where there are broader cognitive impairments.
But
The diagnosis of a learning disorder often involves identifying a significant difference between a child's intellectual ability and their performance in a specific academic area. Like, for example, a 10-year-old with average intelligence who's reading at the level of an 8-year-old might be diagnosed with a reading learning disorder.
So while these originate from physical or neurological differences, they can definitely have psychological consequences, impacting a child's confidence, self-esteem.
Absolutely. Your sources point out that struggling with reading or math can not only hinder academic and later professional progress, but can also lead to significant psychological problems. And it's also worth remembering, many ADHD children who don't have a specific diagnosed learning disorder still experience significant learning difficulties and underachievement in school.
Right.
Sometimes school personnel might mistakenly attribute these struggles to emotional issues or problems at home, overlooking the underlying impact of ADHD on their ability to learn.
Moving on from academic challenges, your sources also describe some resistant, oppositional, and even domineering social behaviors seen in many hyperactive children. It sounds very much like the ODD we discussed earlier, but maybe with some additional aspects.
You're right, there's definitely a strong connection there. Many hyperactive children show a resistance to social demands, those do's and don'ts from adults. They can also show increased independence, sometimes to an excessive degree, and a tendency towards domineering behavior with their peers.
The kid who always wants to be in charge on the playground.
That can be one way it manifests, yeah. But perhaps the most challenging aspect, and a frequent reason people seek help, is their difficulty complying with requests and rules from parents and teachers.
I can imagine.
Your sources even say that some of these children can seem almost impossible to discipline. Parents might describe them as obstinate, stubborn, negativistic, bossy, disobedient, sassy. Like they just don't care. Typical disciplinary techniques often seem ineffective.
It sounds incredibly frustrating for the adults in their lives.
It really does. And your sources highlight that children with ADHD can show resistance in different ways. Some seem to genuinely forget what they've been told.
The inattention aspect.
Could be. While others actively oppose what is being asked of them. On the independence front, it can be a mixed picture. Some might show excessive independence, like a very young child wandering far from home without any distress.
Oh, wow.
While others at the opposite extreme can be excessively dependent, showing immaturity, clinginess, constant attention-seeking behavior. So it's not really a one-size-fits-all picture.
Now, the term emotional difficulties also came up in your sources. How do those typically present in children with ADHD?
Well, what's important to understand, as your sources point out, is that while we use the term emotional problems, it doesn't necessarily mean they are purely psychological in origin. In fact, many are likely not.
Okay. So what's the driver then?
Children with ADHD often experience significant mood swings and cycles, making their behavior somewhat unpredictable. They tend to have a great deal of difficulty regulating their emotions, shifting quite rapidly between different moods. Parents might say things like, "He's happy one minute, impossible to get along with the next," or describe good days and bad days with little apparent reason.
So it's that rapid and sometimes inexplicable shift in emotional state.
Exactly. It's this instability and difficulty in modulating their emotional responses that can be very challenging for both the child and those around them.
As children with ADHD develop, do the specific challenges they face tend to evolve or shift? Your sources touch on this developmental progression.
Yes, there seems to be a typical pattern, though not universal, of how challenges might present at different ages. In first grade, for instance, restlessness often becomes the most noticeable issue at school.
Can't sit still?
Right. Teachers might complain about the child's inability to sit still. Academic problems might be present, but they might not be the primary focus initially, as reading isn't always expected right away. Bedwetting might also become a concern around this age if it persists longer than expected.
And then around third grade, things might shift in terms of what becomes more prominent?
Yeah, around the ages of 9 or 10 or third grade, academic difficulties and what your sources call intentional misbehavior or antisocial problems tend to gain more attention. What might have been seen as immaturity earlier might now be labeled as learning problems or, after testing, learning disabilities. Reading difficulties often become a major concern, but problems with math and messy handwriting can also emerge.
And the intentional misbehavior.
Outside of school, this can include things like deceitfulness, defiance, violating social rules, a lack of consideration for others. It can also involve more aggressive behaviors like bullying and fighting, potentially escalating in some cases to more serious issues like theft, fire setting, vandalism, although the intensity and duration of these problems can vary greatly.
It's sobering to think about that potential progression.
It really is. But your sources also offer a bit of reassurance. They mention that if a child doesn't exhibit certain problems at a particular stage, they're unlikely to suddenly develop them later.
That's good to know.
That's an important point. For example, if a child doesn't have coordination problems when they're young, they're unlikely to develop them later. Similarly, early reading issues are unlikely to just pop up for the first time in adolescence if they weren't present earlier. And while ADHD can be a lifelong condition, hyperactivity itself often decreases significantly with age, sometimes almost disappearing by adulthood. However, difficulties with concentration, persistence, and impulsivity, those might very well persist.
What about the co-occurrence of other serious mental health conditions as children with ADHD get older, like anxiety or depression?
Your sources mention that other disorders like anxiety, serious depression, and bipolar disorder may co-occur in children with ADHD, but it's not definitively established whether they occur at a higher frequency than in the general population. The key takeaway really is that any behavior causing difficulties with others should be brought to the attention of a clinician.
Okay.
For those who continue to experience ADHD-related issues in adolescence and adulthood, a combination of different treatments is suggested as potentially leading to a better outcome.
Now let's touch on the question of what causes ADHD. Your sources strongly suggest a familial pattern and a significant genetic component.
That's right. Studies have consistently shown that siblings of children with ADHD are more likely to have ADHD themselves compared to siblings of non-ADHD children. Additionally, parents and close relatives of ADHD children often report having experienced similar problems in their own childhoods, and many continue to have them as adults. Statistically, a sibling of a child with ADHD has around a 25 to 30% chance of also having it. And a child of a parent with ADHD has about a 50% chance. This strongly indicates a genetic link.
And the research with adopted children further supports this, doesn't it? That helps separate genetics from environment.
Yes, studies of adopted children have been particularly informative. They've shown that the biological parents and siblings of adopted children with ADHD are at increased risk for ADHD, while the adoptive parents are not.
Interesting.
This suggests that genetic factors passed down from biological parents play a more primary role in the development of ADHD than the rearing environment provided by adoptive parents. However, and this is crucial, a genetic predisposition doesn't guarantee that a child will develop ADHD.
Right. It's not destiny. Are there any other potential contributing factors that your sources discuss, besides genetics?
While genetics are considered the most frequent cause, researchers have also investigated other potential factors that could damage the developing brain.
Like what?
Things like complications during pregnancy, prematurity, difficulties during birth, particularly those involving oxygen loss, exposure to lead, and a mother's use of tobacco or alcohol during pregnancy.
Okay.
The common thread here is the potential for these factors to impact brain development in areas thought to be involved in ADHD. Some experts believe that such early brain trauma might mimic ADHD symptoms, but may require a genetic predisposition for the full spectrum of the disorder to manifest.
So it's likely a complex interplay of genetic vulnerability and potentially some environmental factors.
That seemed to be the current thinking, yes.
Now let's shift gears slightly and talk about the impact of ADHD on learning, beyond just the specific learning disorders we discussed.
Right. Your sources emphasize that attention is absolutely crucial for learning. Intelligence alone just isn't sufficient.
Makes sense.
If a child can't focus on what's being taught, they're essentially not able to absorb the information. Learning also requires patience for repetition and practice, which children with ADHD often struggle with. This can lead to them falling behind in school and becoming underachievers.
And this can create a negative cycle, I imagine. Falling behind, frustration.
It sounds like it. Exactly. As they fall behind, they face increased frustration and criticism from teachers, parents, even their peers. They might get labeled as stupid or placed in special classes, which can further impact their self-esteem and motivation.
The relationship between a child with ADHD and their parents also sounds like it can be particularly challenging, based on your sources.
Yes, the parent-child relationship is often strained, sometimes right from infancy due to the child's temperamental difficulties. They might be described as unsatisfiable, even as babies maybe colic sleep disturbances.
Oh, interesting. Even that early.
Yes. As they grow older, hyperactivity, impulsivity, and other behavior problems add to family tensions. Parents often feel like nothing they do seems to help for very long.
And discipline seems to be a major point of contention.
It really does sound that way.
Yeah.
Absolutely. The child's inattentiveness and impulsivity make discipline a significant challenge. They might forget instructions quickly or impulsively repeat forbidden actions.
Uh-huh.
While consistent and firm parenting can have some positive effect, achieving complete consistency can be incredibly difficult. And if parents aren't firm and consistent, the child's behavior can become almost completely out of control.
That sounds exhausting for parents.
Immensely. This difficulty in controlling the child's impulsivity can lead to parental disappointment, anger, feelings of inadequacy, which can create further emotional complications within the family. Ineffective attempts at reward and punishment can also lead to parental confusion and frustration, sometimes resulting in these unhelpful patterns of alternating between excessive harshness and permissiveness.
Wow. This paints a really detailed picture of the multifaceted challenges associated with ADHD in childhood, impacting not only the child, but also their families and their learning experiences.
It truly does.
Let's move on now to consider how ADHD can manifest across the lifespan, extending into adolescence and adulthood.
Okay. What's interesting is how our understanding of ADHD across the lifespan has evolved. Early on, some physicians noticed that symptoms seemed to change, lessen, sometimes disappear as children aged. This led to the idea of ADHD as maybe a developmental lag, something individuals might essentially outgrow.
Right, they'll grow out of it idea.
Exactly. And improvements in some symptoms, like restlessness, might indeed occur around puberty or sometimes earlier or later.
But the picture isn't always that straightforward, is it?
Yeah.
Longitudinal studies have provided more in-depth insights.
Precisely. Longitudinal studies, which follow individuals with ADHD over extended periods, indicate that a significant portion, perhaps half to two-thirds, continue to experience problems in adolescence, with school, family, peers.
So it persists for many.
For many, yes. While some symptoms like bedwetting and maybe overt restlessness might diminish, others, such as difficulties with concentration, lack of persistence, and impulsivity, can definitely persist into adulthood.
And adolescence itself can bring its own set of risks for individuals with ADHD, according to your sources.
Yes, studies of untreated adolescents with ADHD suggest they have a higher risk of developing problems with alcohol and drug abuse, experiencing serious accidents, and becoming involved in antisocial behavior. It's worth noting that these studies focused on untreated individuals and may have included some with undiagnosed conduct disorder, which can also contribute to rule-breaking behavior.
It sounds like those core difficulties with impulsivity and attention can have significant real-world consequences as teenagers gain more independence.
It certainly does seem that way.
Yeah.
And what have the longer-term longitudinal studies revealed about ADHD in adulthood?
Yeah, I'm following them further.
These studies, some of which have followed individuals into their 40s, has been crucial in understanding the adult experience of ADHD. They've shown that while the outward hyperactivity might lessen, the underlying challenges with what we call executive functions.
The brain's management system.
Kind of, yeah. These are essentially the brain's management skills that help us organize, plan, manage our time and tasks. Those challenges can continue to impact various aspects of adult life: work, relationships, overall well-being.
So it's not necessarily about outgrowing ADHD entirely, but rather about how the symptoms might present and the specific challenges they create evolving over time.
Exactly, it shifts and changes.
Now let's move on to a really important area: treatment approaches for children with ADHD. Your sources delve into medication and psychological management. Let's start with the concerns parents often have about medication.
That's a very valid point. Your sources highlight several common concerns parents express about using medication for their children's ADHD. One is the difficulty in accepting that the behavior problems might have a physical basis rather than just being psychological.
Right.
Some parents find the idea of a physically based issue more alarming, perhaps fearing a permanent problem in the brain. However, your sources reassure us that many physical issues, including those underlying ADHD, can often be effectively treated.
Okay.
What else? There's also the concern about medication being an artificial solution, not getting to the root of the problem.
Yes, that's a common worry I've heard, like it's just masking symptoms.
Yes, some parents feel that medication is just a temporary fix. But your sources explain that in the case of ADHD, where the root is often a less efficient functioning of certain brain regulatory functions, medication can actually be seen as a way to improve that functioning.
Oh.
It's sometimes compared to replacement therapy, providing or stimulating the production of needed brain chemicals. It's important to note currently, a permanent cure through medication isn't possible. It's typically needed until the brain matures sufficiently.
And the fear of dependence, that's another big one, especially with stimulant medications.
That's understandable given some of the news around these types of medications.
Absolutely. Because stimulants like amphetamines and methylphenidate can be misused by adults. Parents understandably worry about their children becoming dependent.
Right.
However, your sources are very clear that these drugs have a different effect in children and adults with ADHD compared to non-ADHD adults. Instead of causing a high or excitement, they generally have a calming effect.
Children do not become addicted to these medications, although they might appreciate the improvements they bring. The focus should really be on the balance of benefits versus risks, and for most ADHD medications, the benefits are considered to outweigh the minimal risks. And stimulants often remain effective into adolescence and adulthood for those who continue to experience significant ADHD symptoms.
So what are the actual effects that stimulant medication typically has on children with ADHD? What changes do parents and teachers see?
Your sources list quite a number of positive changes that are commonly observed. Children on stimulants often become calmer, less active, they develop a longer attention span,
Okay.
they become less stubborn, easier to manage, more sensitive to others' needs, they tend to be more responsive to discipline, have fewer temper tantrums, experience fewer emotional ups and downs, show decreased impulsivity, sometimes even beginning to plan ahead.
Wow, that's a lot.
It is. Academically, their school performance often improves, they listen better, follow instructions more effectively, complete tasks, their grades might improve. Even things like handwriting can get better. Their frustration tolerance often increases, leading to less disorganization.
It's almost hard to believe the extent of those improvements. It sounds truly transformative for some children.
For some, the change can be quite dramatic, yeah.
It really does sound like it can make a significant difference. How is this medication typically administered to children? Is it just one pill a day?
Well, modern treatment often starts with a long-acting medication taken in the morning, aiming to provide coverage throughout the day.
Okay.
However, some children might need a short-acting supplement later in the day, for example, to help with homework if the long-acting dose wears off too soon. Conversely, if the medication interferes with sleep, sometimes short-acting forms might be preferred. The goal is really to find the optimal schedule and combination of long and short-acting meds to cover the child's waking hours effectively.
And it's not just about giving a standard dose, right? Dosage adjustment and careful monitoring seem crucial.
Absolutely. Physicians typically start with the lowest effective dose for a child's age and then gradually increase it. They keep going until they see the maximum possible improvement in behavior or until side effects become problematic.
And teacher feedback is key here.
Incredibly important. Teachers observe the child in a structured environment. They can compare their behavior to their peers. So regular communication between parents and teachers is vital, especially when medication dosages are being adjusted.
Right.
Your sources suggest that parents should simply ask for the teacher's observations without suggesting what kind of improvements they expect to see to avoid any potential bias in the reporting. Standardized questionnaires for teachers can also be very helpful in providing objective information to both parents and doctors.
The timing of medication also sounds like it needs to be tailored to the individual child's needs and challenges.
Exactly. It depends on the specific problems the child is facing, and parents play a key role in figuring out the best schedule. Even if hyperactivity decreases with age, parents should still seek detailed info from teachers about the child's concentration, task completion, academic progress.
And stimulants can help even with learning disorders.
Indirectly, yes. By enhancing focus and attention, they can make children with LDs more receptive to remedial education. Handwriting might improve too.
What about the long-term effects of using stimulant medication in children with ADHD? Are there any major concerns that your sources address, like growth?
That's a common question. Studies that have followed children treated with stimulants into adolescence have not shown any long-term negative effects on their final adult height.
Okay, that's reassuring.
Some temporary slowing of growth might occur, but this usually rebounds if medication is paused during summer breaks, although it might need to be restarted if behavioral issues worsen significantly off medication. Weight loss is also common, but it's generally not considered harmful, and weight typically returns to normal when the medication is stopped. Your sources emphasize that most physicians believe the psychological benefits of stimulant medication generally outweigh any minor effects on growth, and they carefully monitor a child's height, weight, and overall well-being throughout treatment.
Are there any non-stimulant medications that are also used to treat ADHD in children, according to your sources? If stimulants don't work or cause side effects?
Yes, there are alternatives. Strattera, also known as atomoxetine, and Wellbutrin or bupropion are non-stimulant medications that might be tried.
How do they compare?
Strattera can offer modest improvement in some cases, but it can have side effects like sedation, fatigue, decreased appetite. Catapres, or clonidine, which was originally developed for high blood pressure, has also been used, sometimes for aggressive ADHD children or as a nighttime sedative. But its effectiveness is considered modest. It takes about 2 weeks to start working, and it has side effects like sedation, dizziness, blood pressure changes. Requires slow discontinuation too.
Okay. Your sources also mentioned the MTA study as a really important piece of research in this area. Can you tell us a bit about what that study found regarding the effectiveness of different treatment approaches?
Ah, yes, the multimodal treatment study of children with ADHD, the MTA study. It was indeed a very rigorous and comprehensive investigation. It compared medication management, intensive behavioral treatment, a combination of both, and standard community care. This was over a 14-month period in children aged about 7 to 10 with combined type ADHD.
And the behavioral treatment was pretty intensive.
Very intensive. It included extensive family and individual therapy, a comprehensive summer program, school-based interventions, really pulling out all the stops.
So what was the main finding?
The big takeaway from the MTA study was the clear and significant impact of medication on the core ADHD symptoms: inattention, impulsivity, hyperactivity, often more so than the intensive behavioral therapy alone.
Interesting. What about combining them?
The combined treatment medication and behavioral therapy showed similar benefits to medication alone for those core symptoms, but it did offer some additional advantages in areas like social skills and parent-child relationships.
So medication seems key for core symptoms, but therapy adds value in other areas.
That's a good summary of the findings, yes.
It sounds like medication can be a very important component, but what about other forms of support, like educational and psychological interventions?
Right. Educational psychologists can certainly play a valuable role, helping children with academic and behavioral problems at school. It's crucial to figure out if these problems are solely due to ADHD or if they're complicated by co-occurring learning disabilities, because both need to be addressed appropriately for the best outcomes.
Makes sense. And psychological management.
In terms of psychological management, well, while medication can be very helpful for many children with ADHD, all children with the condition can benefit from understanding and consistent parenting. Children with ADHD have unique challenges, but like all children, they also experience general difficulties. Family misunderstandings or friction can be particularly problematic for them.
Right.
Your sources emphasize that while ADHD has physical roots, it can lead to secondary psychological problems. And while the child isn't solely responsible for behaviors stemming from their condition, parental attitudes and how they manage the child's behavior also have a significant impact.
So it's a combination approach, addressing both the underlying neurological factors and the resulting behavioral and emotional challenge.
Exactly. It takes a holistic view.
Your sources also go into detail about specific strategies for psychological management, like establishing and enforcing rules. That sounds foundational.
Yes, clear and specific rules are essential for daily routines like hygiene, chores, homework. Enforcement should follow violations, but importantly, only if the rules have been clearly established beforehand.
Okay, and firmness versus harshness.
Good distinction. Firmness involves consistent rule enforcement. It's important and shouldn't be confused with harshness, which is excessive or brutal. Children need structure rules, expectations, values, which doesn't negate their freedom. Consistency in applying rules is vital for a child with ADHD to learn self-control. Predictable consequences help them understand expectations and modify their behavior.
The idea of prioritizing rules also makes sense, like not getting bogged down in every minor infraction.
Yeah.
Pick your battles.
It really does, exactly. Parents should establish a hierarchy of importance for rules distinguishing between essential, important, nice to have, and trivial issues. Focus on the big stuff first, and the consequence should fit the crime, so to speak.
Okay. What about effective punishment?
Effective punishment, according to your sources, means something the child dislikes, but importantly, not abuse or prolonged denial of privileges. Timeout, for example, sending a younger child to their room until they calm down or complete a task, can be a very effective and non-hurtful approach. Clear instructions during timeout are important.
And then there's the flip side. Positive reinforcement, rewarding desired behaviors.
That makes sense, focusing on encouraging what you want to see more of.
Right. Positive reinforcement or reward increases the likelihood of a behavior being repeated. Parental affection and attention are powerful reinforcers for children.
Uh-huh.
Interestingly, even negative attention, like lengthy discussions about misdeeds, can paradoxically reinforce unwanted behavior in some cases. They're still getting attention, even if it's negative.
Your sources also detailed the timeout technique quite specifically. It sounds like it's about removing the child from the situation where they're getting attention for misbehaving.
That's the core principle, yes. The child is informed beforehand about the consequence of misbehavior timeout in their room until they regain control. After misbehavior, they are calmly directed to their room. Only when they are calm can the parent discuss the issue. This ensures the child receives attention for self-control, not for being out of control.
This technique can help children learn to self-regulate and has been effective even with more severe behavioral issues, particularly for younger ADHD children.
Effective communication is also key, especially when it comes to criticism. How should parents approach criticizing their child's behavior effectively?
It definitely is. Criticism should be specific, focusing on the behavior you want to change, rather than making generalized attacks on the child's character. It's about saying, I don't like it when you, rather than, you're a bad child.
Focus on the action, not the person.
Exactly. And acknowledging and validating the child's feelings neutrally without praise or criticism can also be very helpful. It teaches them that all feelings are acceptable, but not all actions are, and helps them learn to express feelings appropriately.
The idea of labeling behavior seems interesting as well, actively naming specific problematic actions.
That sounds like it could help a child become more aware of their own actions. Yes, consistently labeling specific behaviors like teasing or inattention helps the child recognize their own actions. It's seen as a step towards self-control. Your sources note that Russian child psychologists emphasize self-labeling as crucial for self-control.
Interesting connection. And preparing children for changes. That can also be beneficial, especially for those who struggle with rigidity.
That's a good point. Transitions can be hard for many kids, but perhaps especially so for those with ADHD. Discussing upcoming changes beforehand, like moving furniture or new schedules, can help a child who is less flexible to adjust and lessen the impact of their inflexibility.
Your sources also address how to manage a spiraling loss of control, those situations where a child gets increasingly agitated or wild.
Those moments can be so challenging for parents. What strategies do your sources suggest? The key is to recognize the early signs of escalating behavior. Using a consistent label when the child becomes overexcited, like you're getting too wild, and then directing them to their room to calm down. Followed by praise when they regain control. That can be effective.
Okay.
Prevention is also key. Identify triggers and avoid them if possible, or remove the child quickly from the triggering situation.
What about chores and responsibility? How can parents encourage those in children with ADHD? They might struggle with follow-through.
Absolutely. Clearly defining and writing down the specific components of chores helps avoid disputes. Using behavior modification principles like linking allowance to task completion without nagging can encourage compliance. Gradually introducing more chores as the initial ones are consistently done is also a good strategy.
Not for schoolwork.
For things like school assignments, using a small notebook for the child to record their work and homework, with parental checks and reinforcement for accurate reporting, can help them take responsibility. This can be adapted for other areas like hygiene or music lessons too.
The sources also emphasize the importance of addressing family stress and seeking professional help when needed. It's not just about the child.
Definitely not. Family stress, for whatever reason, can significantly impact a child, especially one with ADHD. If parents struggle to agree on rules or have their own personal issues affecting their parenting, it can create psychological difficulties for the child.
Right.
Professional help from psychiatrists, social workers, or psychologists is needed for families facing significant disturbances. Reducing family difficulties will benefit the ADHD child who already struggles with social demands and may not handle emotional stress well, even with medication.
Psychotherapy for the child itself. What role does that play in the treatment of ADHD, according to your sources?
Mm.
Is it helpful on its own?
Your sources suggest that psychotherapy might be a useful auxiliary treatment, but primarily for children who are also being treated with medication.
Okay, so as a supplement.
Right. It can help the child recognize, understand, and deal with their feelings appropriately. While historically seen as a primary treatment, there isn't strong evidence to support its effectiveness in altering the core symptoms of ADHD on its own.
Hmm.
However, experienced psychiatrists often find counseling helpful for older ADHD children, particularly those who have developed low self-esteem and psychological difficulties as a result of their temperament, especially if they didn't receive early medication. A supportive adult can help them understand their problems and find solutions.
The case study about Arnold and his brother was interesting, highlighting how improvement in one family member can sometimes reveal or even trigger issues in another. Family systems are complex.
It really does illustrate the interconnectedness within a family. Exactly. And the various other case studies provided in your sources really bring to life the diverse ways ADHD can manifest and how different treatment approaches can lead to varying outcomes.
Yeah, those examples help.
From Bobby's co-occurring depression to Elaine's primarily inattentive presentation that was initially overlooked, each story offers valuable insights. Cases like Carl, who had both inattentive ADHD and a learning disorder, and Donald, whose family dynamics played a significant role, highlight the importance of comprehensive assessment and tailored treatment plans. Even Fred's history of premature birth as a potential contributing factor, and George's dramatic response to stimulant medication illustrate the range of factors involved.
These childhood experiences really lay the groundwork for understanding ADHD in adults, which is the next area we wanted to explore based on your sources. It seems the diagnostic focus shifts somewhat when we're talking about adults.
Yeah, it does. What's fascinating is the shift from primarily observing behaviors in children to understanding the internal experiences of adults with ADHD.
Yeah. The DSM-5 criteria for children rely heavily on these observable signs. However, adults can articulate their own internal symptoms. The Utah criteria, which were developed based on reports from adults retrospectively diagnosed with childhood ADHD and their partners, offer a more comprehensive picture of the inner and outer lives of adults with the condition.
So it's getting the perspective from the inside out, as it were.
That's a really insightful way to put it. Exactly.
Your sources also mention that early research in adults focused on those with both attention deficit and hyperactivity, the combined type, the more obvious cases.
Yes. In the early days, when the concept of adult ADHD wasn't as widely accepted, researchers focused on the clearest cases, those who had exhibited both inattention and hyperactivity as children. Later, the focus broadened to include individuals with predominantly inattentive symptoms without the hyperactivity.
While many of these individuals do respond to stimulant medication, diagnosis requires careful consideration because inattention can be a symptom of various other conditions that don't respond to stimulants. And in some cases, stimulants might even worsen those other conditions. So diagnostic methods for adult ADHD are still being refined.
Based on these Utah criteria, what are some of the core symptoms seen in adults with ADHD? Do they mirror the childhood ones?
They often do, but maybe manifest differently. The core symptoms in adults, according to the Utah criteria, include attention problems often described as a short attention span, distractibility, difficulty following instructions or completing tasks.
Okay.
Hyperactivity in adults might look like restlessness, an inability to relax, fidgeting, being constantly on the go, maybe excessive talking, even if the overt physical running around of childhood has diminished.
More internal restlessness.
Could be, yeah. Impulsivity continues to be a key feature. Acting without thinking, struggling with frustration tolerance, making rash decisions, interrupting others. Retrospective reports of behaving problems in school are also considered. Additionally, overexcitability, becoming easily overwhelmed by stimuli and temper outbursts, which are explosive but typically short-lived anger episodes, are included.
It sounds like some of the core challenges persist from childhood, but the way they manifest might change, like the hyperactivity becoming restlessness.
They really do sound like variations on a theme.
Exactly. Your sources also mention some additional common problems in adults with ADHD, like mood swings. How are these different from, say, bipolar disorder?
Yeah, mood swings are frequently reported by adults with ADHD, often going back to childhood. These aren't typically the prolonged periods of biological depression or mania seen in bipolar disorder. They're more frequent shifts in mood, often reactive to life events, frustration, loss, even success. They might experience periods of feeling down or bored, as well as times of mild euphoria or overstimulation, which they often distinguish from genuine happiness. These mood shifts tend to be shorter in duration, lasting hours to maybe a few days. However, they can be prolonged by ongoing difficult life experiences.
So shorter, more reactive.
Generally, yes. It's important to distinguish these from biological depression, which tends to be a more sustained period of low mood with other specific physical and emotional symptoms.
That's a really helpful distinction. Disorganization and difficulty completing tasks seem to be another significant hurdle for adults with ADHD. That sounds familiar from the childhood section, too.
Absolutely, it often persists. Adults with ADHD often describe struggling to organize their lives, both in small ways and large. They might be disorganized in problem solving, managing their time. A common pattern is starting multiple tasks but not finishing them. This can lead to projects taking much longer than they should. They might recall having messy desks in school and, as adults, struggle with prioritizing tasks and keeping their workspaces and homes organized.
And stress intolerance. That seems to fit with the picture of emotional reactivity we just discussed.
It does sound like there's a common thread there. Yes, adults with ADHD often report being easily flustered, tense, overreacting to minor difficulties, sometimes feeling like they're making mountains out of molehills.
Right.
This can create a negative feedback loop where stress hinders their ability to solve problems, leading to more stress and a sense of being overwhelmed or demoralized.
Are there other mental health conditions that commonly co-occur with ADHD in adulthood, according to your sources?
Yes, your sources mention that adults with ADHD can also experience other conditions like biological depression, that more persistent low mood, loss of interest, changes in sleep and appetite we talked about, as well as generalized anxiety disorder, which involves persistent worry and physical symptoms of anxiety. These co-occurring conditions often require separate and specific treatment approaches alongside ADHD treatment.
All of these challenges, the impulsivity, disorganization, emotional stuff, can clearly have a significant impact on an adult's relationships and family life. Your sources delve into this as well.
They really can. ADHD in adults can put a significant strain on relationships. Partners might feel anxious, depressed, angry, insecure due to the ADHD individual's disorganization, maybe unpaid bills or impulsivity, sudden decisions without consultation. Things like bossiness, stubbornness, and social imperceptiveness, like difficulty understanding others' feelings, can also contribute.
And parenting.
ADHD parents might also struggle with parenting due to inconsistency, lack of follow-through, unpredictability, temper. This can potentially lead to behavioral problems in their children, especially if the children also have ADHD, creating this cycle that kind of mirrors the parents' own childhood experiences.
So, diagnosing ADHD in adulthood really hinges on understanding their childhood history of symptoms. How is that typically assessed if memories are fuzzy?
It sounds like recalling those early experiences is key, but challenging. Determining the individual's childhood history of ADHD symptoms is crucial for an accurate diagnosis in adulthood. Since adults might not clearly remember or their recollection might be biased, researchers and clinicians use several methods.
Like what?
Asking patients to discuss their childhood with their parents, directly interviewing the parents if possible, and using questionnaires for both the adult patient and their parents to rate childhood behaviors, trying to get corroborating information.
When it comes to treatment for adults with ADHD, medication, particularly stimulants, seems to play a significant role, similar to in children.
Yes, stimulant medication is a primary treatment approach for adults with ADHD. Similar to children, longer-acting formulations are generally preferred, taken once or twice daily to cover waking hours.
Why long-acting?
Well, both amphetamines and methylphenidate are considered equally effective, and if one class doesn't work, the other should be tried. But short-acting forms are less ideal for adults due to the need for structured timing, which, as we discussed, can be challenging for individuals who are often disorganized. Forgetting doses is common.
Makes sense.
Dosage and schedule can vary significantly from person to person, often a larger dose in the morning, maybe a supplementary dose later.
There were also quite strict regulations surrounding stimulant prescriptions, which your sources touch on. That must add a layer of difficulty.
Those regulations are there for a reason, I imagine, but yes, they can complicate things. Due to the potential for abuse, there are often strict regulations limits on refills, short validity periods for prescriptions. While the therapeutic doses for ADHD are much lower than those typically used for getting high, these regulations can complicate the medical management.
But abuse isn't the typical pattern for treated adults.
Your sources suggest that it's unlikely that adults with ADHD who benefit from therapeutic doses would seek to abuse these medications. Higher doses tend to cause irritability rather than euphoria in these individuals.
Are there other medication options for adults with ADHD besides stimulants, according to your sources?
Yes, Strattera and Wellbutrin, the non-stimulants we mentioned for kids, are alternatives. They are less likely to be abused and allow for multiple refills, which can be easier logistically. They might be used when stimulants are avoided due to other health conditions, like maybe an elderly person with a recent heart attack, or if stimulants are ineffective.
How do they stack up?
Strattera can provide modest improvement for some, with potential side effects like sedation and decreased appetite. Wellbutrin, which is actually a stimulating antidepressant, appears to be less effective than stimulants for ADHD in adults, particularly for concentration and organization, and it's not a long-acting medication.
It's interesting that your sources mentioned that improvement in ADHD symptoms might be perceived differently by the patient and their spouse. The spouse might notice more.
That's a fascinating point. The person experiencing the changes might not be as aware as those around them. That's a key observation. Spouses often report more significant positive changes in the ADHD individual's behavior and functioning than the individuals themselves might initially recognize. This really highlights the impact ADHD can have on relationships and how treatment can positively affect those dynamics.
There are also some potential unexpected health-promoting effects of stimulants in ADHD adults that your sources mention, like with smoking or drinking.
That's surprising. I wouldn't have necessarily thought of that. Yes, some individuals with ADHD have found that stimulants can reduce their nicotine cravings, making it easier to quit smoking. And some report it helps with reducing excessive drinking,
Oh.
possibly by improving impulse control or reducing the need to self-medicate. Also, by improving organization and focus, medication can contribute to a less stressful lifestyle overall. Even if blood pressure is slightly elevated by stimulants, if the overall benefits are clear, this can often be managed with additional medication.
The case studies of ADHD in adults really illustrate the diverse experiences and treatment outcomes, just as they did for children.
They really do. From the patient with co-occurring sleep disorder and depression, needing both Concerta and an antidepressant, to David's dramatic improvement in marital problems with medication, these stories underscore the complexity and the potential for positive change.
And the personal accounts, they seem very powerful.
Immensely powerful. The personal accounts offer insights into the lifelong struggles, the battle with focus, impulsivity, emotional regulation, and the truly transformative impact effective treatment can have on self-perception and relationships. It seems many adults with ADHD carry a sense of guilt or badness from years of struggling before understanding their condition.
That really resonates the idea of finally understanding why certain things have always been so difficult, not just being lazy or difficult.
That's a profound point. Many adults describe this lifelong battle, often internalizing their difficulties as personal failings. The realization that these are symptoms of a neurodevelopmental condition can be incredibly validating. But as you said, the ingrained feelings of guilt and inadequacy can persist even with effective treatment. The perspectives shared by partners are also invaluable in understanding the severity and impact of ADHD symptoms and the positive changes that can occur with appropriate intervention.
This has been a truly comprehensive deep dive into your sources on ADHD. We've covered so much characteristics in childhood, co-occurring conditions, its impact across the lifespan, and the various treatment approaches for both children and adults.
Yeah, we covered a lot of ground.
Hopefully you, the listener, now have a much more in-depth understanding of this complex condition, moving beyond just surface-level descriptions to grasp the nuances highlighted in the material you shared.
Absolutely. And maybe a final thought to leave folks with. Considering the often subtle yet profound impact of ADHD on an individual's life and relationships, what are some of the broader societal implications of recognizing and effectively addressing this neurodevelopmental condition across all ages? What might some of the ripple effects be in areas like education or the workplace or even just interpersonal interactions if we had a greater collective understanding and better support systems for ADHD?
Definitely a lot to consider there. Thanks for joining us for this deep dive.
My pleasure.
Until next time.